Well, I think there's a number of things that CNOs can do. So I think that addressing our workforce issues are twofold, right? It's both recruitment and retention because it doesn't help to just keep hiring people only to have them leave in a year or two. So I would say the first thing that I would say is needs to be done is you have to listen to the front line and really understand what it is that they're telling us. You know, what's important to you? What would make you want to stay? What are reasons that you would leave this job and go to another job? You know, what is going to help you to feel more like you have a sense of belonging in our organization? And what's important? What can we do? And we have to be open to a new way of doing things. I think just admitting to ourselves that what we're doing is not working is the first step, right? But the second step is then creating a plan based off of what we have heard from that front line and saying, these are the things that we're going to work on. You know, what I heard when we did this with our frontline nurses, work life balance. They don't want to work weekends anymore in the acute care setting. Well, that's tough. We're open 24 hours a day, 7 days a week, right? You know, they don't want to work as many holidays. And so how do we help to get them there? How do we offer lesser weekends by experience? Maybe there is something that we can do. And we found a path forward by, adding in weekend programs at a premium rate of pay. You know, yes, it did cost the organization, but I'll tell you, we get a lot of experienced candidates wanting to come to our hospital, and they're saying, I'm going there because I've been a nurse for 15 years. And if I go there, I don't have to work any weekends anymore. So, that's a big thing to people. And then for the people who want to work the weekends, we have a great opportunity for them. So, being able to earn higher dollars and work less hours is really great for some people who are going to school or have young families and want to avoid daycare costs. And so being open minded with that. I think the other thing is that we have to start looking at innovative care models, starting first in the areas where we're really struggling to hang on to staff and to hire into. For my hospital, that was the acute care floors, our med surge floors. All the other positions within our children's hospital, family birthing center, emergency department, and the ICU, they seem to be the more sought after that I didn't have trouble recruiting into. But I mean, we really struggled with acute care. So we knew that we were going to have to make some pretty major changes to that care model to have it look very different, to not only make it maybe exciting for people to want to work in an acute care setting, because like one of my leaders said, if you think that acute care is boring, then you're doing it wrong. It is exciting. Our patients are sick on those floors. But, how do we come around those nurses to better support them? Because what we're hearing them say is that work is hard. And the care model of yesterday no longer fits. I think anybody who's been in the nursing profession for 20, 30 years will tell you, like, patients are sicker today. We've made amazing advancements in medicine and we're saving lives. And those patients are ending up in the hospital. The ones that were in the hospital 20 years ago, they're going home now. So, we have to figure out how to support our models of care in a different way. And that could be different support staff, different ancillary staff, or it could be technology like the addition of virtual nursing.